All right, we're back for part 2 as to what you can do when that bacterial vaginosis or that smelly discharge keeps coming back. Remember, the reason why we get bacterial vaginosis in the first place is because the bacteria and the yeast that are in the vagina get out of balance. You end up with too much bacteria, now it's heavy, causing the discharge that's causing your discomfort. We talked about metronidazole or flagyl being the common treatment used for bacterial vaginosis. But let's do a deeper dive as to why that doesn't always work. About 30% of strains of bacteria that are responsible for bacterial vaginosis, they kind of get accustomed to metronidazole or flagyl and they are resistant. So when we have someone that continues to get BV over again, we know now that flagyl isn't our first choice. Our first choice should be clindamycin. Clindamycin can come in the form of a pill that you would take twice a day for 7 days, or a gel that you could put in the vagina, either for 3 nights, 5 nights, or there's even some one-night preparations. Something else that we recommend is something called boric acid suppositories. They look like little pills almost that you would put in the vagina, and you would use it while you're taking the antibiotic for the bacterial vaginosis. A common mistake many of my patients make is taking the boric acid without the antibiotics. You know, it's kind of like taking a water gun and putting over roaring fire. You're going to dampen it some, but you're not going to put the fire out. It's going to give you the impression that you feel better, but you're really not. Sometimes for those cases of BV that keep coming back, we're going to ask you to have your partner treated too. So I want you to lock in for part 3 and we'll talk about why.